Hey guys, welcome to the podcast. I have a very special guest. My partner in crime, Patrina Pellett, is here. She's MSL Excellence Lead for our company, MSL Mastery. And we're really excited because we have a new training program for AI that's amazing. And this episode is sponsored by MSL Mastery. So you have to go and check us out. Go to mslmastery.com, where we have training programs for MSLs, and we have coaching programs and online courses, and it's just amazing, amazing. We're so proud of the progress that's being made. And today we're going to do something a little different. So I just got back from a conference, which was AI in medical affairs, and so many people have asked me about it that I want to tell you about it. And who better than to ask me and be the host of this episode than the one and only Patrina Pellett.
This is a hostile takeover, guys, of the MSL Talk podcast. We're changing it to Patrina Talk, and
Yep.
I'm really excited to introduce my guest today, Tommy Caravella.
Yeah.
Just attended this conference. Are you ready to get started, Tom?
Oh yeah. So many people have asked me, like, they couldn't make it. How was it? Was it good? Can you share it? And I'm like, you know what? I think we just should have an episode where we talk about AI and talk about some of the stuff that was covered in the conference, because I think it's really beneficial.
And let's plan on doing another one next year and the following year as AI progresses. That'll be such a cool follow on.
Yeah. Oh no, totally. And here's the crazy thing. This was the fourth annual AI.
That's
I'm
so
like,
crazy.
really?
I didn't even
What?
hear of this before.
Yeah, me neither. But they got their they did a great job. So
They're ahead of their time.
for sure. For
All
sure.
right, Tom. So set the stage for us.
Hmm.
Where were you at? What was it like? How many people were there? Were there vendors everywhere? Just set the scene for us.
Yeah. Well, it was a great venue. It was in Philadelphia. It was cold. But it wasn't in a hotel. It was in a place called Cyto PHL, which is almost, it was specifically like a place that you rent to do small meetings, conferences, seminars, not big. There was probably 100 people there. There were vendors, really smart people. I mean, it was just actually a really intimate atmosphere that, and the venue I thought was really cool. I was worried that I'm like, well, it's not a hotel. So what's parking going to be like? Parking right there in the building. It
Oh,
was really
nice.
convenient and awesome.
Okay, awesome. So it was a cold day in Philadelphia at a cool, hip, modern location.
Totally.
So tell us a little bit about what was covered in the conference and which AI topics were discussed.
Yeah. So I feel like they touched upon and covered, hit on most of, if not all of the major areas of AI. So for example, like core capabilities of AI, use cases, a lot of talk about use cases, which I think a lot of people wanted to see. How are other organizations utilizing utilizing AI for their MSLs, for their medical affairs department, for patients? Like it was like really touched on all the different areas that and use cases. How can AI enhance medical affairs and medical affairs organizations, not just like MSLs? How can it improve patient outcomes? And then there was a lot of talk about efficiencies, both on the corporate side and individual.
Okay, so which would you say was the most popular topic out of those? Which one was resonating the most?
I think, well, it's interesting because it seems like everybody got excited about the efficiencies. How can I get better? How can my people get better? But it seemed like there was also like a lot of eye-opening information about the patient side.
Hmm.
We're in this this patient centricity of what can we do? It all goes back to the patient, as we know. So it's like, what are some of the things I need to learn about how there's improvements in patient outcomes because of artificial intelligence? That seemed to get a lot of attention and a lot of buzz too.
Okay, cool. Cool. So tell us about some of these use cases.
Mhm.
What were you seeing there? Give us some examples. What went down?
I will, and this was so it's this seemed to be probably the most time was spent on this piece. And there were a lot of different speakers that covered a lot of different versions of this, but they all overlapped to an extent.
Okay.
So I'm going to give you kind of a basic overview of what I saw as some of the common use cases. Um, so number one, analysis of information through artificial intelligence. So data and databases and the extracting and analysis of information so that the learnings would be streamlined and it would be more efficient, or the use of data is more efficient. Also, as it relates to even social media and social listening and how to extract data from social sites, um, and the internet. So that was definitely one category. Then there was the applications for data generation,
Okay.
which is a whole nother category. Um, your favorite topic, insights. So
Yeah, you got to tell us more there. Yeah.
so synthesizing insights through use of artificial intelligence was a whole nother area of discussion and another use case. Then there's the communication and information sharing, tailored and personalized communication, um, both for internal and external stakeholders. Content development. Obviously, you know this
Obviously.
better than anybody because you develop more amazing content than anybody out there. You and Sarah kind of go, toe to toe on content creation. So I know that you guys know the importance of utilizing artificial intelligence for content creation. Um, Training initiatives, learning and development. Obviously, as you know, we continue to build out training programs, and the stuff that you and Sarah are doing are absolutely next level. It's just interesting to see how important it is to use all of the benefits of artificial intelligence to not only develop the best content, but to do it in such a time efficient manner is really kind of the key. The other thing that was interesting too was predictive analytics. So looking more on the patient side of the equation, and the use of diagnostics, and then the data analysis coming from, on the patient side, with wearables and different types of new technology that has AI built into it is really, really amazing. And where things are going in science is just mind-boggling.
Yeah, wow, sounds like a ton of stuff was covered. Do you have a granular, very specific use case you could share with the audience just to give them a sense of some of the details around what people were sharing?
Yeah, so and you're gonna laugh because I'm gonna share something that I thought was brilliant as a very detailed use case, but you wrote about it in one of your blogs or your
Guys, I'm
newsletters.
just
Like,
trying to do a shameless plug here.
well,
Like,
no, this was like this literally like it was so new to, I think, a lot of people there, but it's not new to you or Sarah. And so anyway, one of the things that happens with MSL specifically is just information overload. Having to educate yourself on certain information and having to use that information for your KOL engagement. So let's just say you have to plan for a KOL visit and you want to make sure that you're leaving no stone unturned. And maybe that KOL just released a paper, an article. Maybe there's a ton of articles and papers from this KOL. Maybe it's the first time you're visiting them. Maybe there's just all this information that you need to curate in order for you to understand that KOL better and be prepared for that meeting. Well, you can take all of that data, put it into Notebook LM, and ask it to create a podcast that you can listen to educate yourself on that data in preparation for that meeting. Now, you
so
know this.
yeah, people's minds exploded, right?
Exploded.
Yeah. Like, it's really cool, you guys. If you haven't checked it out, go to notebooklm.google. You just need a Google account and you can upload anything you want. So, like Tom said, one paper, you could even do series of papers from the same KOL and just click a button. generate podcasts. It is awesome. And if you want to learn a way to level this up, go to medicalaffairsvalue.com, find the podcast or the blog post on how to turn papers into podcasts, and I give you a specific prompt to really up level your KOL engagement. So definitely check that out or reach out to me if you want to know. And now we're going back over to Tom. All right. So where and how can AI enhance medical affairs? What were the folks saying there?
Yeah. So, and a lot of different really good contributions. I think as a summary, I wrote a couple of things down. So operational efficiencies and engagement was one whole big area. So taking, for example, manually intensive tasks such as MedInfo, standard response letters, patient summaries, creating animations and graphics, all through the use of AI can streamline all of that. So again, I think this falls under the category of like efficiencies, if you will. Um, Insights and personalized communication. So the idea of tailored communications kept coming up and personalized communications, and I think that this is something that medical affairs is trying to achieve to develop and create and build stronger relationships with
Yeah.
KOLs. And through use of technology and AI, we can learn more about our external stakeholders to be able to do that. That notebook LM example is like a perfect way to describe kind of how that can happen. Um, the other thing is that was brought up a lot was evidence generation. So I didn't mention this before, but like one of the things that they talked a lot about was, real world evidence and evidence generation through AI, extracting data from databases as it relates to the patient. Like there's so much that I was unaware of, and I think a lot of people are unaware of how AI can touch the patient and really improve outcomes. We're just scratching the surface.
Yeah, that sounds amazing. I had an experience myself recently on the power powerfulness, is that a word? The power
Yeah.
of the power of using AI to analyze insights. So, guys, never put your proprietary insights into an open model. But I just published a blog post where I took synthetic insights. So I had AI generate 100 insights, bad ones, and then I had AI rewrite those to make them more complete. Then I asked it to do an analysis on this. So mimicking what people in medical affairs would do, my mind exploded because it just analyzed 100 pretty big insights in seconds. I was texting Sarah about it actually. I was like, this would take a medical affairs person days. It's crazy, especially the summarization capability. So again, don't put your own insights into an open model, but if you have a closed model, try it out. Ask it for
Mhm.
a summary. Your mind will be blown. I want to mention one other thing
Yeah.
around personalization. So, Tom is spot on here on how you can really use AI to help personalize your outreach to KOLs. I have a blog post on this called How to Use AI to Uncover What Your KOL Values. And I have a very specific prompt that you could copy and paste into your model, whichever one you're using, and then just plug in your KOL's name, and it's going to spit out a huge report for you. So definitely check that out as well.
Love
Um,
it.
Let me continue to hijack this. No, wait, this is my episode.
It's your episode. Wherever you want to go.
All right, so let's go back to the patient journey
Yeah.
stuff. Um, you were talking a lot about patient journey, which I think is really cool. I personally haven't been thinking a lot about that. But then the link to RWE or real world evidence,
Mhm.
tell us more about that.
Yeah, so from what I gathered from that, it's that relates to the collection of data, um, and the power of AI algorithms applied to the patient experience is a total game changer. So how to apply treatment protocols for different diseases through evaluating and analyzing the data that's coming from these algorithms that are being applied. Like I look at it as, and I don't know if this is a great analogy, but um, rare diseases, there's there are people that are walking around undiagnosed right now because they have a rare disease and they're not
Nobody
sure
knows
what
about
it
it.
is.
Yeah,
So just imagine how by using AI and taking that data and entering it into a system, we can maybe narrow down and diagnose these people quicker and find treatment protocols for these people. Because I just don't think we're doing as good a job at that right now as we should. And again, that's kind of my example. That wasn't exactly something that they talked about, but when I left there, I was like, geez, I bet you that is a thing.
that would be a total game changer. And I know there are a lot of medical affairs teams that show impact of their work by linking it to time to diagnosis. So they might say, oh, we have a medical education campaign on this rare disease, and then start looking at if they can, through claims and whatnot, see if the time to diagnosis is decreased and showing the impact of their work. So I think, yeah, that is super cool. Obviously for showing impact, but more importantly for the patients, right?
And the other, yeah, and to answer your question too, because I did write some notes. You asked me about the real world evidence and patient journey. One of the things a couple things they talked about was to identify predictors from electronic health records. So that's where that whole, rare diseases thing came from. Basically curating trial data, and how the analyzing of that data is just going to lead to such better accuracy in uncovering unmet needs and then inform strategy.
Yeah. That's going to be, I can't wait to see more of these use cases as we go to more of these conferences. That's going to be awesome. All right, let's talk about value. You
Yeah,
know, guys,
you're the
me and
value
Tom,
queen.
we're all about value, right? Adding value to you, adding value, helping you add value. So, what is the value of AI for medical affairs now that you've attended this conference? Or what do you have to say about this?
Well, and I took a lot of notes on this because I really felt like this was really the take, like what were the takeaways and how valuable is this? And it touches AI can touch so many different areas. It can define and drive strategy, HCP identification,
That's
resource
a new one.
allocation. I talked before about personalized communication and the value that you can get from using AI for messaging, for example. I talked about content development, patient centricity, real world evidence, validating insights. One of the things I didn't mention, but this is think about the value in identifying trends
Hmm.
and identifying areas of unmet medical needs. So these are all things that I feel can come from really getting good at utilizing artificial intelligence tools and implementing them within, our day to day.
Yeah, that is super exciting. And I can see why so many people were so excited after leaving that meeting. All right, let's transition to AI and MedInfo. You alluded to this earlier with standard response letters, I think. What else?
Yeah. So on the MedInfo side, what I picked up on is that AI is now being used for adverse events, specifically with detection tools. Companies are using AI for their FAQs, scientific engagement, summaries from posters, conference content, insights. And then also, AI for medical writing, which is a whole nother category. I kind of threw that into MedInfo, um, but definitely all these areas I kind of feel was discussed in the MedInfo section.
Was there any specific examples there around like FAQs or standard response where people, I guess in my mind, and I don't know a lot about this, but in my mind, they have the AI write something and then a human looks over it and gives it the final approval. Did they talk about anything like that during the conference? Like any examples of how they're
No, not
nitty
not
gritty?
specific to that, but to your point, one of the things that came up a lot was the importance of the human element. And the idea that this would be a machine-driven process that a human runs and manages, not a machine-driven process that the machine runs and manages. It just spits out and a stat and helps with the whatever that use case is.
Yeah, that's a really good point. I always feel like, a lot of people talk about, oh, AI is going to take our jobs. And when people say that, it makes me wonder how much time they've actually spent in it. Because when you start really playing with AI, it makes a lot of mistakes. And at this point in time, I would be surprised if it takes over, especially medical affairs jobs. What do you think, Tom?
Yeah. No, it's funny. I and look, I'm hoping nobody loses their job because of AI. I hope it creates more jobs. Right now, it absolutely requires human element. It requires, well, think about it. It requires the human has to operate the system, otherwise there is nothing to generate. So if you don't know how, for example, to use the tools that you have and use the right prompts, for example, you're not going to get the output that you need, so it's worthless. So that's kind of the other piece of it. Is I think one of the biggest challenges that I see, and you could see it by the overwhelming interest in this area, is that people still don't know what it is, how to use it, what it means for them, what tools they should use. So the reason everybody showed up, I think, to this conference, and the reason people are listening to this is because they want to see what's everybody doing, what's everybody else doing, what tools are they using. When you asked me about, can you give me a specific use case, and I told you about the notebook LM thing that I learned from you. That's a perfect example because it's a real example of how you can apply it. And that's what people are looking for.
Yeah. Yeah. Oh gosh, I had something I wanted to say and now I totally lost it. Um, oh, I
It'll come
remember
back to
now.
you.
There's a really great article I read about comparing AI to other softwares and why the uptake is or can be challenging. So the author equated or said that other softwares have a specific way to use them. So there's a
Mm.
right way to use them. With AI, there's no rules. You have to make up your own rules and really know what you want and how to get it out. And so I think this is linking to your prompt engineering comment. But
Yeah.
before we go on to that, let's talk about what you learned around improving business efficiencies through
Yeah.
AI.
That was a really big part of this. And so what I learned is that companies are using AI tools to improve upon metrics and goals. So that was another piece of it. Performance reviews, reporting, definitely being able to cut down on the reporting and administrative side of the
Yeah.
equation. Call notes. I mean, that seems like an obvious one, but is everybody really utilizing it? Utilizing AI for that piece of it. Um, what I also learned is that using the right tools can make an immediate impact. And the way companies seem to be using it is by automating process workflows. So, for example, a lot of people are using MS 365 Power Apps, which, from what I understand, is a great use of both automation for efficiencies powered by AI, and it's kind of a low cost solution. It's there's no real barrier of entry to that. So MS 365 Power Apps, it was mentioned a couple times. Um, but it says that I wrote down, so if an organization has no AI solutions, it can start at the app level
Hmm.
with minimal investment, money, and time. And that would be that MS 365 Power App would be an example.
That sounds really cool because I think everybody has 365,
Yeah,
right? So it's an
yeah,
ecosystem that we're all in already. I think that sounds pretty cool. And I think a lot of folks along the lines of what you were saying with business efficiencies, are not using even the features that Microsoft has. So, for example, depending on what version you have, you can just summarize emails with AI. And
Right.
so think about when you have those huge chains, like the really annoying ones with all the not signatures. I was like out of office, no signatures. And it just adds up and you're like scrolling forever. You can just say, summarize this email and give me action items. Like that's like huge time saver. It's such a small thing, but that adds up.
That's it. But that what you just said, that's a great example. It's a
Yeah.
great example.
It's
Yeah.
like I was there.
It's you should have been there.
I know. I really should. I felt that way after.
I told them you need to speak next year at that event
Oh, I would love
for
to.
sure.
I have a at Mass West a session coming up. If you
Yeah,
guys are
you
going
do.
to that, definitely come to my session. I'm going to give real live use cases.
Oh
It's going
boy.
to be it's going to be really awesome. Okay.
Amazing.
All right, back to today's topic. Was there anything that was not covered that you think would have been really helpful?
Yeah, and this is another thing that I learned from you and from Sarah is the importance of prompt engineering. And that really wasn't that should have been its own topic. And I feel like there could have been at least one session on the art of prompt engineering. You guys do this better than anybody. And you have the like seeing the scripts or the examples of prompts for MSLs that you incorporated into the training program blew my mind. I didn't even know that that's how you do it. Like, I know how I do it, but that's so rudimentary compared to what you should do. And that wasn't really a part of it.
Yeah, like I mentioned, AI, it doesn't have one way to use it. You don't just click here, there, and there. You have to really understand how to interact with it. And having a set of rules or frameworks around that is super important. Something Sarah and I include in our team training on AI is a whole section on writing effective prompts. So we give you frameworks on how to structure your prompts to get better output. And then going beyond that, how do you refine your output so that it's actually really useful? So I think something I've seen a lot of people do is they kind of put in a crappy prompt and then they get crappy results out and then they stop. And so I think appreciating that it's iterative. And I published an article last May on how to use AI for creativity and productivity. And I put one of my top prompts in there, or refining prompts, let's call it. And I got so much outreach and comments on it. So I'll tell you guys what it is. It's if you have some AI output and you don't like any of the ideas, some are okay, but you need more, you just write, give me 10 more. And the AI
Mm.
will just spit out 10 more. And you can just keep doing this. Give me 10 more, give me 10 more. And I think that is a really underappreciated use case of AI just for ideas generation. It's going to eventually find something that you haven't thought of yet and just really make your creativity explode. I think that's a really cool use case that's underappreciated.
I love talking to you about this because you get so excited.
Oh my God, I
Like
love
you
it. I
love
love
this.
it.
You love
Can I
this.
can I tell in the last couple of minutes my favorite use case right now?
Yeah. Oh yeah.
Personally.
Yeah.
So I'm a big journaler. I plan, I journal, I write a daily journal, daily plan, daily journal every day. The end of the week, I take my 7 entries from the week before and I put those into Notebook LM. I tell Notebook LM to act as a life coach that specializes in intentional living and to give me ideas, suggestions, prompts, tell me how I grew over the last week. And I just interact with this chatbot to help me do my self reflection. But to Tom's point earlier on Notebook LM's capabilities for making podcasts, I click generate podcast and make a podcast about my life. And
Mm.
I love listening to it. And the cutest thing too, my husband loves it. He's always like, "Can we listen to your podcast?"
Oh,
Like,
that's awesome.
it's so sweet. And it's so funny to hear your life described in that way. Like it'll often start out like, "Oh, we're going to take a deep dive behind the scenes in the life of an entrepreneur." Right.
Yeah.
And like just
Yeah.
hearing it talk about you that way is really interesting. But okay, bringing us back to the AI and Medical Affairs conference. Any other tips? So we're about to wrap up here. Any other tips or advice you can share from what you learned at the conference?
Yeah. So, and this first of all, and I'm going to coin a phrase that I heard you say last week in one of your blog posts or your messages or posts or whatever.
Wherever it
Garbage in,
was.
garbage out.
Yes.
Garbage in, garbage out. So when it comes to prompt engineering and it comes to prompts, you really have to know what you're doing. The other thing that came through loud and clear, I touched upon this before, and this is the analogy. Don't take your hand off the wheel.
Oh, I like it. I like it.
And the analogy is that we have self-driving cars right now, but do you really feel comfortable getting in them? Like, I want to keep my hand on the wheel. Like, okay, self-drive, but I'm still going to be here just in case.
So
Like
no
that's
Waymos for you. No Waymo.
no, no.
Okay, because Waymos are here. People use them all the time in
Well,
Phoenix.
listen, I just feel like that's a great analogy to say
Yeah.
you can't leave AI to its own devices. Needs the human element. Stay involved. I think that that's just good advice, and that was something that came through pretty loud and clear. It was talked about a lot. Um, and the other thing too is, and I learned this from you and from Sarah. One of the things I didn't realize about prompting is that you can ask AI questions and ask for feedback. How is my prompt? Should I be asking it this way? Here's what I'm looking for. Am I asking it, so you can actually ask for advice from the AI tool. You don't have to just sit back on your own devices and say, "Hey, I need to
I got
know
to figure
this."
this out. Yeah.
So, yeah.
Yeah, to along those lines, I have a ton of custom GPTs that I use for specific tasks, and people ask me, "How do I write the system prompt?" And I'm like, I use AI to write it. So I just tell it that it's an expert prompt engineer and that I need a system prompt to do this, and then it writes it, and then I plug it in. Yeah. So to Tom's point, leverage the tools, know what it's capable of. Any one last final thing, Tom, before we hang up on you?
Um, Stay on top of this. Don't be afraid of it. Embrace it and try it and jump in the pool and start swimming because it's here and the people that are embracing it, their eyes are starting to open up. Are like, wow, geez, this isn't that scary. I can do this. And look how much it's helping me. So I would say if you're sitting on the sidelines, get in the game and start playing around with it because it's here and I think it really can help you. That's kind of what I learned.
Yeah. Yeah. Well, thank you so much, Tom. Let us know what you guys think of this hostile takeover of the MSL Talk turned Patrina Talk podcast. Let us know what you think. We always love hearing from you guys. If you're not following me and Tom and Sarah on LinkedIn, please do. We create a lot of great content and we really love hearing from you guys. Thank you, Tom. Thanks, everybody,
Patrina
for listening.
Talk. I
Yeah.
love it. It's the new thing.
Yeah.
Thank you, Patrina. You're the best host
Yeah.
ever.
Thanks, guys.
All right.
Bye.
Thanks, guys. See you next time.